Welcome to the University Health Services Manoa Lokahi Peer Education WISH presentation. Today we will go through a trivia game which highlights how tobacco affects the smoker and non-smoker, as well as discuss reasons why tobacco is so addictive. We will also introduce social norms theory and how it relates to the University of Hawaii at Manoa students. Let's start off with an information update about tobacco. What do we know? We know that smoking is the most preventable cause of death in our society. Tobacco is linked to several chronic illnesses such as lung cancer and heart disease. Additionally, tobacco causes premature aging of the skin and more frequent respiratory illnesses. The average annual cost for a pack-a-day smoker is approximately $1,800. Try out this question. How many people die of tobacco-related illnesses each year in the United States? 5,000? 10,000, 50,000, 75,000, or 120,000? The answer is 120,000 people die of tobacco-related illnesses each year in the United States. These deaths are not only from smoking, but also from chewing tobacco and from deaths attributed to secondhand smoke. So, if you're not a smoker, how does smoking affect you? Because only 15% of smoke is inhaled, while the remaining 85% goes into the air, as a non-smoker, you are negatively affected by tobacco smoke. Secondhand smoke causes 36,000 deaths from heart disease annually. Secondhand smoke also leads to 3,000 new cases of lung cancer per year in non-smokers. Children with parents who smoke are more likely to suffer from a variety of diseases. Another vulnerable population, pets, are negatively impacted by secondhand smoke. The toxins in cigarette smoke hurt the lungs of your dog and even pollute the water in your fishbowl.
Okay, let's test your tobacco knowledge. Why don't you try your hand at this question? Are light cigarettes safer than regular cigarettes? True or false? The answer is that light cigarettes were created to give the illusion of being safer, but actually they contain just as much nicotine and tar as regular cigarettes. Many countries around the world, including Canada, have actually banned the term light because it gives smokers the impression that somehow it's safer. Okay, let's try this question. What do you think? Is smoking through hookahs or pipes safer than smoking cigarettes? True or false? Actually, hookahs and pipes contain the same deadly chemicals and products that regular cigarettes do, and have the same effect on the body. It doesn't actually matter if tobacco is flavored or colored differently, it can still do the same amount of damage. True or false? Rolling your own cigarettes is safer than smoking the store-bought kind. Rolling your own cigarettes can be less expensive than store-bought cigarettes, and often these products are marked organic or natural tobacco alternatives. However, this type of tobacco is still linked to several types of cancers, and because it lacks a filter, more tar can be inhaled with hand-rolled cigarettes than the store-bought ones. Okay, let's look at some additional tobacco myths. For example, chewing tobacco is a safe alternative to smoking. Now, while chewing tobacco will probably not cause lung cancer, it has been proven to cause several forms of mouth, tongue, and throat cancer. It also can be responsible for bleeding gums, tooth decay, mouth ulcers, and chewing tobacco usually contains larger amounts of nicotine than regular cigarettes. Here's another myth. I don't smoke enough cigarettes to get addicted. Some people do call themselves social smokers because they only smoke while they're out with friends, while they're drinking, or maybe when they're with other smokers. Social smokers often don't purchase their own cigarettes, and as a result they don't really feel like regular smokers. However, social smoking has been linked to lung cancer, heart disease, and it can compromise your immune system. Most regular smokers today actually started out as social smokers. One more myth. If I quit smoking, I'm going to gain weight. Well, actually, if you keep your food intake the same after you quit, you're probably not going to see a big increase in your weight. It's the snacks that replace cigarettes that may cause the weight gain, especially if they're sweets, so make sure you choose low-carb snacks when you're quitting. And remember, once you quit, you're going to start to feel more fit, which means you can increase your exercise routine and your metabolism rate, which will make you feel healthier overall.
In the past 30 days, what percentage of UHM students do you think smoked tobacco even just one day? 1 to 15%, 16 to 30%, 31 to 50%, or 51 to 70%? Have you smoked tobacco in the past 30 days? Yes or no? The past two questions are related to the social norms theory, which states that people tend to overestimate risk and underestimate healthy behavior. Like most UHM students, you probably overestimated the percentage of UHM students who smoke cigarettes. The actual percentage of smokers is 11.8%. So you can see that the vast majority of students, 88.2%, engage in healthy behavior by choosing not to smoke. Tobacco truths. Did you know that tobacco products are the only legal consumer product that kills 1/3 of the people that use them? And tobacco is not regulated by the FDA, so as a result, tobacco companies are not required to list ingredients, including ammonia, formaldehyde, and acetone, on the labels. If it's so dangerous, why do people smoke, and why is it legal? One of the reasons people start smoking is due to aggressive marketing techniques. Tobacco companies target specific vulnerable groups, such as college freshmen, minorities, and LGBT students. Many people continue to smoke because cigarettes are such an addictive product. 7 out of 10 smokers are still smoking 5 years after starting. And the reason tobacco products are legal is the lack of government intervention. Tobacco companies are very powerful lobbyists, and tobacco taxes provide the government with a lot of revenue.
There's never been a better time to quit, and there are some great resources to help you or someone you care about stop smoking. For more information about tobacco and quitting smoking, please visit the Beat It website displayed on the screen, or contact the University Health Services Health Promotion Program in the Queen Liliuokalani Center for Student Services, room 313, or call us at 956-8060. Thank you.